This is group 21. For our herbal presentation, we'll be going over quercetin, a natural molecule that can be found in fruits and vegetables such as apples and in onions. There are many indications for quercetin. The most commonly used with the best evidence are lung and pancreatic cancer, rheumatoid arthritis, cardiovascular disease, as well as high blood pressure, high cholesterol. It's also used for a number of other indications, including arthritis, metabolic syndrome, ulcers within the digestive tract, polycystic ovary syndrome, cataracts, gout, and urethral syndrome. There are a few others that are used within specific combinations with other products, such as asthma, kidney transplants, and diabetes. Some additional information about indications. There is a lot of ambiguous labeling on different products. Many of the products that we saw online that are commercially available have different claims on the packaging without a lot of evidence supporting it. There is a lot of recent research into the possible health benefits as well as going forward for quercetin. And there have been claims that it can be used for COVID-19, but there's no good evidence to support any of these claims. One last thing, it can also be used as a supplement for athletic training. It's been seen in a few studies that it can be taken to help muscle recovery, performance, and endurance, as well as avoid any exercise-induced respiratory infections.
Regarding effectiveness, there aren't enough reliable evidence showing the effectiveness for most indications like autism spectrum order, benign prostatic hyperplasia, and cardiovascular diseases. And for athletic performance, taking 500 milligrams twice daily for 8.5 days is not as effective as taking 1,000 milligrams daily for 14 days. So it's ineffective for that indication. For asthma, it's effective. Taking 250 milligrams to 500 milligrams daily for 30 days reduces asthma symptoms. For kidney transplant, it's effective as well. Taking 20 milligrams of quercetin along with 480 milligrams of curcumin improves the early function of the transplant. For rheumatoid arthritis, it's effective. Taking 800 milligrams of quercetin for 8 weeks improves the arthritis symptoms like morning stiffness and pain. It's effective for diabetes too. It reduces the level of glucose by 7%. It's effective for lung and pancreatic cancers as well, especially for male smokers. Lastly, for hypercholesterolemia, it does not reduce the LDL cholesterol level, so it's ineffective for that indication.
So one of the maximum doses for quercetin is intravenous doses higher than 722 milligrams may cause nephrotoxicity. However, there is a wide range of doses that have been used, ranging from 250 milligrams to 1,000 milligrams. It can also be used in combination with other drugs, and at that point, it can be used in doses as low as 20 milligrams. You may use up to 500 milligrams twice daily for up to 12 weeks intravenously, and it is not known if oral doses higher than 500 milligrams are safe or if it is safe for long-term use. Some potential risks for quercetin include nephrotoxicity, and if it's safe to use when pregnant or breastfeeding. There's not enough reliable information for those, so they cannot say if it is safe or not. There are a lot of drug interactions, most of them with the moderate interaction rating, and all of them have a level of evidence of B or D. Some examples of these drug interactions include antidiabetics, antihypertensives, cyclosporin, midazolam, pravastatin, quinolone antibiotics, and diclofenac. And within these, you can see what would happen. Most of them will either subsequently lower blood pressure along with antihypertensives. They may reduce the effects of the drug or inhibit it.
So for the convenience of quercetin, the Red Book from Micromedics said that there's a few generics available ranging from $5.25 to $26.45 for the average warehouse price. It can be taken orally either through a drop or a tablet, otherwise intravenously. when you're in the hospital and having to treat cancer. The dosing regimen for typical for Quercetin is 1 capsule twice daily or 2 drops. The dosing can be confusing due to every product having a different amount per recommended serving size. So for example, with the drops, it's 134 milligrams of Quercetin, and for the capsule, it's 500 milligrams of Quercetin. So for the summary of the recommendations for practitioners and patients, for the practitioners, we would recommend them to treat rheumatoid arthritis, since there is high evidence that it works to reduce morning stiffness and morning pain. And lots of clinical studies are still being done for indication and effectiveness for other indications. For the patient, lots of drug interactions, so make sure to speak with your pharmacist or doctor before taking it, and avoid taking the medication if you're pregnant or during lactation, since there's insufficient data on the safety for the infant. And here's just a quick list of our references that we use to compile the presentation.